What's up, students and medical coders? My name is Professor Shafstall. I am the Health Information Technology Program Director at Bakersfield College. I'm bringing you this little web series that I have titled Medical Coding 101. I'm going to be developing videos and lectures to go over the basic fundamentals of medical coding, to reiterate the things that students and medical coders need to know for quizzes, exams, and just your career in general. So we need to make sure that we know, understand, and work on memorizing this information. There's no way getting around it. This is what you need to know. This is our first video, and I'm calling it Medical Coding 101, an introduction, what you need to know. So this is going to be just cracking open the topic of medical coding. We're going to start off simply by asking ourselves, what is medical coding? The definition to memorize is: coding is the transformation of verbal descriptions into numbers provided in a classification system. So basically, you're translating information into a certain system following that certain system's guidelines. That's what coding is. But for us as medical coders, I want to translate this even more, because this definition is a little confusing, because it's saying that we're transforming verbal descriptions into numbers provided in a classification system, and to an extent, yeah, that's what we're doing. But us as medical coders, we code what clinicians record in the medical record. It has to be written in the medical record for us to code it. The golden rule is, if it's not written, it didn't happen, which means we cannot code it. All codes have to be supported and justified by the medical record content. So that means we don't code anything that someone tells us verbally. We don't make any assumptions. We simply just code what is in the medical record. Now we ask, how do we code? We know what coding is now, but how do we code? We code by utilizing code sets, and these code sets are mandated by HIPAA, the federal statute. The Health Insurance Portability and Accountability Act of 1996 actually tells us and directs us what codes to use and in what situations to use them. These are the code sets that are acceptable to the federal government, and there's a whole slew of them. But the code sets that are going to be taught here at Bakersfield College and at most health information technology programs are going to be the big three code sets. And those code sets are Icd-10-Cm, Icd-10 Pcs, and Cpt. Icd-10-Cm is known as the International Classification of Diseases, the 10th revision, clinical modifications. Icd-10 Pcs stands for the International Classification of Diseases, the 10th revision, procedure coding system. And then we have Cpt, which is current procedural terminology. And yes, as students, you need to know the full names of these code sets, okay? So Icd-10-Cm, how do we use it? Well, Icd-10-Cm is used for coding diagnoses, okay? I will refer to diagnoses as DX in my writing to students, so I want you to get used to knowing that DX stands for diagnoses. But when we're coding for, an illness, an injury, condition, the reason a patient is seeking health care is going to be coded for the ICD with the Icd-10-Cm code. So I like to say when we code, we are telling the story of the patient's visit. And I like to say that the diagnosis codes are the why codes, right? In our story, they're telling why the patient is seeking treatment. Next, we have Icd-10 Pcs, and this is procedure coding. And if you didn't pick that up from the actual name, now you know. PCS, procedure coding. These are used to code procedures and operations. I will use the abbreviation PX in writing with the students to let them know that I'm discussing the procedure code with them by using the abbreviation PX. But what's important about this is the Icd-10 Pcs code set is only used in the inpatient setting only. So what does that mean? We will discuss in another video patient settings, but the only time we use PCS is when a patient has been formally admitted to a hospital as an inpatient. Otherwise, you're going to be using another code set, which we will quickly address, okay? The patient has to be formally admitted to a hospital in order to use Icd-10 Pcs to code for procedures and operations. The last code set that you're going to learn at Bakersfield College is CPT, the current procedural terminology. This is also procedure coding. This is used to code procedures in the outpatient setting, all outpatient settings, and it also is used for physician services. So we're identifying physician services at all levels. So these physicians, when they're performing procedures or providing care, they can be reimbursed. And that's what CPT is. So to reiterate, CPT is used in all outpatient settings. So if you're having a little procedure in the emergency room, it's going to be CPT. If you're having an outpatient surgery, CPT, okay? But CPT is used in all settings, inpatient and outpatient, to identify and bill physician services. So those are our 3 code sets that are going to be taught at Bakersfield College: Icd-10-Cm, Icd-10 Pcs, and CPT. So a fun fact to know is when you code or use a procedure code, you can never use a procedure code, whether it's PCS or CPT, without having a diagnosis code to support the procedure code. Remember how I told you that Icd-10-Cm, when telling a patient's story, is telling the why the patient is seeking treatment? Well, the PCS is saying what happened after the patient sought treatment. So you have to tell the why the patient's seeking treatment to understand what happened to the patient while they were seeking that treatment. Now let's go a little in further. So now we're going to look at what we need to know about these code sets. So now we know some basics. We know what Icd-10-Cm, Icd-10 Pcs, and CPT code sets are. We know that Icd-10-Cm is diagnosis coding and that Icd-10 Pcs is procedural coding, but in the inpatient setting only, and that CPT is procedural coding as well, as long as physician services, and that the procedural coding only occurs in the outpatient services. We also need to know more information about every code set. So coders need to know some basic information regarding each code set. And that information is: why is the code set used? How is it used? Who developed it? Who maintains it? When did the code set come into use? How often is the code set updated? And what is the code set's purpose and the patient setting that the code set is used in? Well, let's dive into this and check out Icd-10-Cm. Icd-10-Cm, why is it used? Icd-10-Cm is used to focus on morbidity in the US. And we need to remember that term, morbidity. We're talking about disease. So we're coding conditions and illnesses using the Icd-10-Cm, and this is being reported. So we are focusing on morbidity, which is disease in the US. A lot of students will think that morbidity and mortality is the same thing, but it's not. We are focusing on the disease in the US and not necessarily the death in the US. So Icd-10 is used to focus on morbidity in the United States. How is it used? It's used to capture diagnoses. Who developed it? The NCHS developed it. And yes, you're going to have to remember all this ABC language. There's a ton of it, and you're going to have to know it. So NCHS is the National Center for Health Statistics. NCHS also maintains the Icd-10-Cm as well. Icd-10-Cm became effective. It was started to be used in the United States on October 1st, 2015. Yes, you're going to have to remember this date, okay? It's actually quite a big date in medical coding history in the United States because it took a long time for Icd-10 to even be implemented and used nationwide in the United States. So when did Icd-10-Cm come into effect? When was it mandated that everyone's using it? October 1st, 2015. How often is Icd-10-Cm updated? Icd-10-Cm is updated April 1st and October 1st each year. Okay? The new code books come out October 1st of every year. What is its purpose and patient settings? Again, the purpose is to report diseases and conditions, right? The morbidity of patients treated in all settings in the United States healthcare system. So it's not like procedure coding where one's used in an inpatient setting and one's used in an outpatient setting. Icd-10-Cm is used in every setting, whether you're admitted to the hospital, you're at an urgent care, or you're at a physician's office. Icd-10-Cm is going to be the code set used to identify why patients are seeking treatment. So again, this information is pertinent for all students to know and coders to know about the Icd-10-Cm code set. So let's go ahead and take a look at the Icd-10 Pcs code set. So why is it used? Icd-10 Pcs is used to report procedures in the United States. How is it used? It is used to capture procedures and operations. Who developed Icd-10 Pcs? This is different from Icd-10-Cm. The 3M company had a contract with CMS to develop Icd-10 Pcs. So 3M developed it, and CMS and the HHS maintains the PCS code set. This too became effective on October 1st, 2015. So I like to remember that CM and PCS, they went live on the same date, right? So Icd-10 went live on 10/1, the 10th month, right, in 2015. Just like CM, how often is it updated? It is updated twice a year on April 1st and October 1st, and the purpose is to report hospital inpatient procedures only. Now we're going to take a look at Cpt coding. So why is Cpt coding used? It's used to report outpatient procedures and physician services for billing. How is it used? To capture procedures and operations and physician services. Who developed Cpt? That is the AMA, and the AMA also maintains Cpt. When did it become effective? In the US, Cpt started to be utilized in 1966. The version that we know of today was utilized, or should I say adopted, in 1977. But it first became effective in 1966. How often is Cpt updated? Once a year on January 1st, okay? So we need to keep these dates organized in our head. Icd-10 is all about the 10th month. That's October. Cpt is January 1st, normal calendar year. What's the purpose of Cpt? It's to identify procedures in the outpatient setting and to identify billable services provided to patients regardless of the patient setting. So it's a lot of information, but this should not be new information for anybody. But I want to stress patient settings and code sets. So I know I said we're going to go into more detail in another video, but we still need to stress the proper use of the code sets. So Icd-10-Cm is used in every patient setting. Icd-10 Pcs is used in the inpatient setting only. Cpt is utilized to capture procedures in the outpatient setting only. However, it is used in all settings to report physician services, also known as physician billing. I know that I keep reiterating the same stuff over and over again, but this is what students have an issue understanding. You can take Coding 1 and Coding 2 and be in your clinical experience and still be confused between Icd-10-Cm and Icd-10 Pcs. I don't want that. We need to have a firm understanding when we start to take our exams, the difference between Icd-10-Cm and PCS, all their history, why they're used, how they're used, when they're used, all that good stuff. That should be second nature to students and coders alike. So, now you know the basics of medical coding when we're talking about code sets. The information should be memorized and understood by all coders. This information is frequently tested. Okay? So it's important to understand the different code sets, especially these three that we go in depth in our Health Information Technology program at Bakersfield College. If you have any questions or comments, feel free to leave a comment for me and I'll get back to you as soon as possible. I hope you enjoyed this video, and remember, it's all about the basics.